Hello everyone, we are Team 7. Today we are talking about lung cancer incidence and mortality in China. Our speech will start from the following 5 aspects. Firstly, we will talk about the background of lung cancer, and secondly is problem statement and research objectives. Thirdly, we will talk about the research methodology, and the fourth one is data analysis. The last one is conclusion and suggestion. Okay, now let's get into the first part. Let's say the part 1, which is background of lung cancer. Let's see the morbidity and the mortality. Why we choose lung cancer to be our topic? Because according to the data from the GlobalCan 2020, lung cancer is already one of the most common cancers worldwide and the leading cause of cancer-related deaths. The number of newly diagnosed lung cancer cases worldwide reached 2.21 million, accounting for 11.4% of all diagnosed cancer cases, and lung cancer have killed 1.8 million people. According to the World Health Organization, lung cancer can manifest itself through a variety of symptoms, such as cough, chest pain, shortness of breath, coughing up blood, fatigue, and so on.
Part 2. Problem statement and research objectives. Lung cancer is a major public health challenge in China, not only with high mortality but also with many social and economic pressures. Furthermore, current prevention strategies remain inadequate, so we need to conduct comprehensive studies on its morbidity, mortality, and ultimately key measures to prevent and treat lung cancer. Research objectives. In this study, we want to understand the latest trends in lung cancer incidence and mortality in China. Secondly, we want to explore the impact of gender and age on the incidence of lung cancer. At the same time, we also will study which factors are the main factors causing lung cancer. Finally, current lung cancer prevention, detection, and treatment are evaluated to identify areas of programs. Our ultimate aim is to contribute to the treatment of lung cancer in China. Part 3. Research methods. Our research adopts a mixed research approach that combines quantitative and quantitative methods. By reviewing the literature and comparing the previous studies, the research on lung cancer was submitted. At the same time, data was collected and quantitatively analyzed using sparse.
This part is our data analysis.
This is the part where we conduct data analysis. First, we analyzed the distribution of cancer around the world in 2020. As can be seen from the figure, Asia is the region with the highest number of new cancer cases, and China is the country with the largest proportion. China has more samples to support our research. And then let's look at the relationship between gender and age. The graph on the left shows the incidence of lung cancer per 100,000 people between 1988 and 2012. For men and women, it can be seen the lung cancer rates increased in both men and women throughout the period and were higher in men than in women. Through the figure on the right, we can see that the incidence of lung cancer begins to increase significantly after the age of 40, and there may be an exponential growth relationship between age and incidence. In order to verify our previous hypothesis, we conducted t-tests for gender. From the results of the test, the p-value is less than 0.05, rejecting the null hypothesis. We have significant evidence to say that gender has a significant impact on the incidence.
For different age groups, we conducted one-wheel ANOVA and the results showed that there were significant differences in the incidence of lung cancer in different age groups, especially in the elderly group. The incidence increased significantly, and the difference was even greater in the group over 55 years old. The result test of this table confirms the exponential distribution of the data, and the significance level of 0.263 is much higher than 0.05. This suggests that the incidence distribution in the 40 to 85 year age group is statistically exponential. We established a mathematical model and carried out curve regression through SPSS. We can obtain a model to describe the relationship between morbidity and age, which can be expressed as this equation. Next is the analysis of impact of living habits, living environment, and other facts on lung cancer mortality. As can be seen from left graph, smoking, household air pollution from solid fuel, and ambient particulate matter pollution were the top 3 cases of lung cancer deaths in China in 1990. Household air pollution caused by solid fuels dropped from 2nd place in 1919 to 5th place in 2019. No matter how other facts change, smoking always ranks first. The graph on the right includes the average death rates for each factor from 1919 to 2019. So, from the average incidence of lung cancer from 1990 to 2019, the top 4 cases of lung cancer death in China were smoking, environmental particulate matter, household pollution from solid fuel, and second-hand smoke. Here are their respective ratios.
This was followed by qualitative research, including through literature review. At this stage, China has implemented various national and local measures to prevent lung cancer, including public health promotion and education programs, continuously promoting anti-smoking measures, and working to build a national cancer prevention and control platform, screening, early diagnosis, and treatment as the major national public health service. These measures have shown some effect. In Beijing, Shanghai, and other cities, the Healthy China Action Plan has been implemented ahead of schedule to reduce the adult smoking rate to less than 20%. The ban on public transport reflects a holistic health approach to tobacco control, in which various departments are actively involved. But it's also a huge social and economic burden. Lung cancer prevention in China struggles against at a 26% smoking rate and rising incidence. Despite the Healthy China 2030 goals, challenges include tobacco use, pollution, urbanization, and healthcare policy neglect, necessitating comprehensive solutions. Finally, there are some solutions that we think are effective. First, provide smoking cessation programs and smoking cessation ads to help smokers quit, as well as publicity and education activities to reduce the smoking rate and exposure to second-hand smoke. Second, strengthen environmental protection policies and personal protection measures to reduce the impact of environmental factors on lung cancer. The third is to promote healthy living. People need regular exercise and a diet rich in fruits and vegetables for those at high risk. Promote early cancer screening programs to detect lung cancer early, and strengthen research on vaccines and drugs.
Now, let's go to the last part, Part 5, Conclusion and Suggestions. According to our research, although the incidence of lung cancer is on the rise in both men and women, it is significantly more common in men than in women. Secondly, the incidence of lung cancer increases with age. Thirdly, we found out that the main factors causing lung cancer in China are smoking, environmental pollution, and second-hand smoking. When we draw our conclusions, we make compares with previous studies. It was found that there was a high degree of similarity in the causes of lung cancer, which also proved the accuracy of our research. In the end, we hope that everyone can use our research to protect the health of themselves and their families. Our presentation ends here. Thank you for listening.